Hello, I'm Dr. Miller.
How you doing? I'm Garen Azizi.
Nice to meet you,
You too.
Mr. Azizi.
You too.
So, what brings you into my office today?
Well, the other day, actually, yesterday, I was playing basketball and went for a layup and I landed on my right foot wrong. Kind of just twisted it this way.
Right.
And I'm just in a lot of pain. It's swollen, so I'm not sure if it's broken or what the case is.
Okay. If you had to point to one place that hurts the most, where would you point?
Right here.
So right here?
Yeah, it's just
Okay.
it's surrounding this.
Like right
area.
below the medial malleolus. Alright. How long have you had this pain?
It literally happened yesterday at night, so I couldn't go to the doctor, so I came today.
Okay. Pain has like a character. Would you describe it as like sharp or burning or throbbing? How would you describe it?
I don't really know how to describe it. It just hurts.
It hurts? Is it like a really strong hurt or a weak hurt or?
It hurts. I mean, I can't describe the pain.
Shooting?
I guess it's a shooting pain or a sharp pain.
Okay.
But I'm not sure.
Alright, so shooting or sharp. Is there anything that you've been doing that helps it?
No. I decided not to take anything or do anything to it until I came to you.
Is there
It
any?
literally happened last night. So.
Okay. Is there anything that makes it worse?
Well, I mean, obviously, if I put some pressure on it, right, or when I walk on it, I try not to.
Okay.
I haven't moved around much.
So the pain that's right here, does it ever travel up your foot or down your foot when you feel it?
No, it's centered right over there.
Okay. Now you mentioned that this happened, last night.
Yeah.
This morning, with the pain, has there been more pain at a specific time, like in the morning compared to now? Or, what's the timing been like?
Well, it doesn't, not specifically at a certain time in the day, but like I said, when I put pressure on it, it hurts, and I mean, otherwise it just hurts. There's mild pain throughout the day, but
Okay.
when I put pressure on it, it hurts more.
Okay. Now, if you were to rate the pain on a scale of 1 to 10, 1 being not that painful and 10 being excruciating pain, what would you call it?
I'd give it about a 5.
A 5?
Yeah.
Okay. So, Mr. Azizi, at this point, I would like to do an actual history, a medical history. So, you yourself, have you had any diabetes, hypertension, high cholesterol, heart disease, any of that?
No.
Okay. Your immediate family, your mom, dad, and grandparents or siblings, have any of them had diabetes or kidney disease, cancer, heart disease, hypertension?
My grandma died of pancreatic cancer, and she also had diabetes.
Okay.
Besides that, no.
Okay. At this point, well, beyond that, have you had any past surgeries?
I've had my tonsils removed, but that's about it.
Okay.
And that was when I was 10 years old or something.
That's nothing to worry about.
Yeah.
Alright, at this point, I would like to do a social history, so I'm going to ask you some personal questions, but it's in our best nature to learn these because it can help you with your ankle pain. So, how much sleep are you getting at night?
4 to 5 hours a day.
Okay. You smoke?
No.
Okay. How's your sex life?
I have a girlfriend, so it's a monogamous.
But it's monogamous?
relationship.
And do you use a condom?
Yeah.
Okay. Alright, what do you do for work?
I'm a student.
Okay. Exercise. What do you do for exercise?
I don't really exercise too much, honestly. With school, I don't find much time to exercise. I try to play tennis and basketball here and there, but that's pretty much it.
Okay. Do you drink?
Socially, yeah, from time to time.
Like
Special occasions.
special occasions,
Yeah.
but only a couple drinks.
Yeah.
Okay. How's your diet?
Not so good. I eat a lot of fast food since I don't cook at home.
Okay.
But right now I'm actually fasting, so staying away from dairy and meat.
Oh, that's good.
Yeah.
All right. Do you do any hardcore drugs like marijuana, cocaine,
No,
ecstasy?
no. I try to stay away from that.
That's good. Okay. Do you have any pets?
No,
Okay. Are you married?
no.
All right. And recently, have you traveled anywhere?
I mean, besides going back home to Chicago
Okay.
on the breaks we get,
But
but
in the
no,
last like 2 months, you haven't gone anywhere.
no.
Okay. That's good to know. All right. Beyond that, I want to take a just standard medical history. So, have you recently been hospitalized?
No.
All right. Have you had any childhood illnesses like measles, mumps, chickenpox?
I had the chicken pox. Yeah.
Okay. You have all your shots, hepatitis,
Yeah.
and all that. Okay. Do you take any medication currently?
No.
Okay. Do you have any allergies? Okay. Have you had any transfusions?
No.
Okay. So, because of the nature of my profession, I need to ask you your emotional state. So I imagine everything's going well, but I'm just going to ask you some very simple questions. What day is it?
Today is Thursday, March 30th,
Okay.
2017.
And who's our current president?
Mr. Donald Trump.
Okay. All right. So I've done all the history and physical and social. So now I'm going to do a physical exam on you. So I need both your feet up here. All right. So the first thing I'd like to do is a standard dermatological exam. So I'm going to look at your skin. So I'm looking for any rashes, macules, papules, varicose veins, anything abnormal. So I don't feel anything. Everything looks good on the bottom of your foot. I don't see any calluses. Underneath, you're fine. No ulcers. Same over here. No calluses. Everything looks really great. All right, you have hair growth. That's good. That means your vascularity is fine. Beyond that, your nails, they look good. They're healthy. I'm going to look for maceration, just any wetness in between your toes. So I don't see any so far. So good. Okay, that's good. So now I'd like to do a vascular exam.
Okay.
So, all right, your posterior tibial. Okay, it's 2 out of 5 on both. They're both good. And then your dorsalis pedis. All right, again a 2. Good. And then I want to do your popliteal. Okay, 2 out of 5, normal. All right. Now I'm going to do capillary refill time. So basically, I'm going to push down on your toes and see if they return with blood within 3 seconds. And they do. Okay. That's good. Going back to the skin, I'm just going to make sure you don't have any pitting or any edema. And then I'm going to check the turgor of the skin. And that is good. All right. Temperature-wise, all right, going down. You're warm to warm, so you're good. Okay. The next thing I'd like to do is I would like to do a neurological exam. So the first thing I'm going to do is I'm going to do a Sims-Weinstein monofilament test. This is going to test for neuropathy. So I want you to feel this so you know what's up.
Okay.
So basically what I'm going to do is I'm going to use this and I'm going to test different points on your foot and I want you to say yes if you feel it. The one trick is I need you to have your eyes closed so you can't tell.
Alright.
So if you please close your eyes.
Alright.
Okay.
Yep. Yes. Yes. Yep. 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 Yep.
Okay, did that perfectly.
Sure.
All right, the next test I'd like to do is I'm going to do a vibratory test.
Okay.
So I want you to see this. As you can see, it's just normal. What's going to happen is I'm going to vibrate it, and you're going to feel it,
Okay.
and then I want you to tell me if you feel it, and then when it stops, I want you to tell me immediately when you feel it stop like this, okay? Again, I need you to close your eyes. So, do you feel it?
I feel it.
Okay, tell me when it stops.
Okay. Stop.
Okay, I'm going to do the other foot now.
Okay. I feel it. Stop.
Okay. Your vibratory senses are A-okay.
Awesome.
All right, now I'm going to check for Babinski. So I'm just going to take the bottom part of this, and I'm going to move it up slowly, and that's fine. And then I'm going to go up here slowly. Okay, you're good on that. Now I want to do a proprioception test. So what I'm going to do is, again, I need your eyes closed. What I'm going to do is I'm going to take your big toe. I'm either going to put it up or I'm going to put it down. And I need you to tell me without looking if I have your toe up like this or down like this. Okay? So eyes closed.
Down.
Okay.
Up.
And keep them closed.
Down.
Okay. And
Up.
all right. Good. The next thing I want to do is I want to do a sharp and dull test. Mr. Azizi, if I can see your hand, this is the sharp, so you'll feel that. And then this over here, this brush, this is the dull, and that's what you feel. So again, I need you to keep your eyes closed, and I need you to tell me if you feel sharp or dull. So,
Do it again. No, that's the sharp.
okay. And this,
Dull.
okay. This,
Dull.
okay. This,
Sharp.
okay. This,
Sharp.
this,
Dull.
this.
Dull.
Okay, thank you, Mr. Azizi. The next thing I want to do is I'd like to do your Achilles reflex and your patella reflex. So I'm just making sure those reflexes are intact. So I'm going to come over and do this. I'm going to be very careful with your ankle. All right. So all right, I'll get this 1, 2. Okay, and then okay, and then all right. 1, 2, 3, and then okay. Thank you, Mr. Azizi. Now the last exam that I'd like to do is going to be your muscle exam. So I need both your feet up here. Okay. Now I realize that you have an ankle injury on your right foot here. So if it hurts, just stop, because I don't want to hurt you. But okay, can you push out? These are your everters. Okay. Can you push in? All right. Can you push towards me? Your plantar flexors, and can you pull towards you? Okay, those are your dorsiflexors. Your strength is good. So now I'd like to do a silver squint test. So what I'm going to do is I'm going to put you in STJ neutral. So I find your 2 malleoluses, and then I follow the tibia, put it right at the second toe, and then I see if I can get 10 degrees. So I got 10 degrees. Now I want you to bend your knee. All right, and I'm going to, again, find the tibia, second toe, put an STJ neutral, and 10 degrees. So you're fine. Now I'm going to do the other leg. All right. Again, tibia, second toe, STJ neutral. You got 10 degrees. Bend your knee. All right. STJ neutral. And 10 degrees, okay? So I've done all the tests that I wanted to do, and we've gotten an excellent history and physical. With the current knowledge that I have right now, I want to say that you might have torn a tendon or possibly, fractured something. As of right now, I want to send you to get a couple x-rays. This will help, but I'm sure it's nothing we can't handle.
Okay, thank you, Doc.
No problem. Thank you, Mr. Azizi.
Appreciate it, thank you.